right. We're breaking barrier strategies to boost telehealth pod utilization. What is Parkland? Parkland was founded in 1894. It's the county hospital, and it's also a safety net hospital. It's funded mostly by taxpayer dollars, and it's a top 15 largest public hospital system in the United States, and they serve the underserved. What is a telehealth booth? It's an opportunity to receive telehealth care, avoid going to clinics to receive care, allows people without internet to receive telehealth, and allows an opportunity to streamline care for chronic diseases.
So the problem we are facing is a low utilization of the booth. Our goal is to increase usage at the West Dallas Multipurpose Center to 10+ visits a week. Our barriers that we have found are unclear signage, trust issues, digital literacy, and procedural complexity. Our methods were a qualitative on-site assessment and secondary data analysis. Some key insights we found is that technology alone is insufficient, and there needs to be a community-led, equity-driven approach.
Our literature analysis. In a 2023 study conducted by Parkland, they found that telehealth reduced no-show rates by 29%, saving the hospital a lot of money as no-show appointments are expensive. Reduced telehealth engagement in the Hispanic communities. Non-English speakers have a lower user rate than other races. Following studies done in other large cities like New York and Los Angeles, engagement increased by putting booths in trusted public settings, streamlined user interfaces for first-time users, and used trusted community members to serve as digital navigators.
The findings at the Inspired Vision Community Center showed that there's significant health disparities with high rates of unmanaged chronic illnesses, late-stage diagnoses, and heavy reliances on emergency room services. The low pot usage was mainly due to cultural distrust, lack of digital literacy, due to confusing and complex login processes and instructions within the booth. And main barriers to access were the lack of in-person guidance to the booth, the lack of an initial champion group, and the physical size of the booth.
What we found at the West Dallas Multipurpose Center was that there is an existing infrastructure to support this integration of the pod. Cultural norms and word of mouth are very prevalent and are part of the success of a new pod. Staff training and trust is also crucial for the success. There are existing health screenings as a pipeline to the pod, and the lack of immediate clinic access at Tejero shows the need also for this pod, showing that Parkland staff is critical.
Our findings had overarching themes of chronic illnesses, cultural distrust, and lack of in-person guidance and support that come through language barriers. And then important aspects are community strength and opportunities through word of mouth and staff that trained to build trust with the community.
So here are our recommendations. Number 1 is to improve visibility and outreach. 2 is build community trust. And 3 is expand booth accessibility. Number 1, improve visibility and outreach. We want to replace the label video visit booth with something more specific, such as Parkland telehealth booth. We also believe that distributing printed flyers would be helpful, as 87% of people prefer health information in person. The target outreach group that we're aiming to advertise to is specifically the WDMC senior group. And specifically with that, we would like to get 1 to 3 of the senior group to be advocates for the telehealth booth and spread the word to their peers.
Looking at building community trust, we recommend having an on-site Parkland representative to build consistency and confidence in this community by visiting 2 times a month, either from 9 a.m. to 12 during the senior group or 3 to 5. This will build confidence and trust in the community by assisting in MyStart registration and logging in. Also, we propose advertising the financial awareness program to decrease any barriers of cost. And as Ashley Hutto quotes, word of mouth is very important and it needs to be right the first time. So we propose having an opening party to build confidence and trust and welcomeness in the community.
Finally, is expanding booth accessibility. While this may not be feasible for specifically the WDMC, future booths could use this, as the current booth stands at 6.5 feet tall, 4 feet wide, and 4 feet long. As you can see, JJ in the photo is almost as tall as a booth. So it would be very difficult for someone with, or if they needed a caregiver or mobility aid to fit in. So some simple recommendations will be wheelchair ramp or wider doorways.
And lastly, our budget. We are proposing a $10,000 increase in the budget. This will deploy our simple marketing ideas and our overall ideas. This is very feasible as it's only 3% of the total budget. And the reallocated savings from other areas in the FY26 telehealth budget can be used to fund our ideas.
Thank you.